Welcome back to Friends Corner 682. I am Ava, and I will talk about the kidney problem today. At the outset, let me make it clear that this is an informational video only made for general public awareness. Therefore, any part of the video should not be taken as a medical diagnosis or advice and should not be used as a substitute for medical prescription. Your kidneys are silent heroes working 24/7 to keep you alive, but when they start failing, the consequences can be life-threatening. Did you know that over 37 million Americans have chronic kidney disease, and it is now the 9th leading cause of death in the United States? In the next 25 minutes, we'll cover everything you need to know about kidney problems: what they are, what causes them, how to prevent them, all available treatment options with their pros and cons, the crucial role of diet, and essential post-treatment care. Here's what we'll cover: understanding kidney function and common problems, root causes and risk factors, prevention strategies, treatment options comparison, dietary guidelines for all stages, post-treatment precautions. Let's start by understanding what your kidneys actually do. Your kidneys are remarkable organs about the size of your fist, located on either side of your spine below your rib cage. Think of them as your body's sophisticated filtration and regulation system. Normal kidney function. Every day, your kidneys filter about 50 gallons of blood, removing waste products and excess water to create about 1-2 quarts of urine. But that's just the beginning. They also regulate blood pressure by controlling fluid levels, produce red blood cells through erythropoietin hormone, maintain electrolyte balance sodium, potassium, calcium, etc. Activate vitamin D for bone health, remove toxins and medications from your blood. Major types of kidney problems. 1. Acute kidney injury, AKI. This is sudden kidney damage that happens within hours or days. Think of it like a car engine suddenly overheating. It's a medical emergency requiring immediate attention. 2. Chronic kidney disease, CKD. This is gradual loss of kidney function over months or years. It's like slow erosion you might not notice until significant damage is done. CKD has 5 stages. Stage 1. Kidney damage with normal function, 90% plus capacity. Stage 2. Mild decrease, 60–89% capacity. Stage 3. Moderate decrease, 30–59% capacity. Stage 4. Severe decrease, 15–29% capacity. Stage 5. Kidney failure, less than 15% capacity, major types of kidney problems counted. 3. Kidney stones. Hard deposits of minerals and salts that form inside your kidneys. Imagine trying to pass a small, jagged rock through a straw. That's the pain level we're talking about. 4. Polycystic kidney disease, a genetic disorder where fluid-filled cysts grow in the kidneys, gradually destroying normal tissue. 5. Glomerulonephritis. Inflammation of the kidney's filtering units, often triggered by infections or autoimmune conditions. Warning signs you should not ignore. Changes in urination, frequency, color, or pain. Swelling in legs, ankles, feet, or face. Persistent fatigue and weakness. Shortness of breath. Nausea and vomiting. High blood pressure, metallic taste in mouth. Muscle cramps and twitches. Remember, early kidney disease often has no symptoms. That's why regular checkups are crucial. Causes and risk factors. Understanding what damages your kidneys is the first step in protection. Let's break down the major culprits, primary causes. 1. Diabetes, leading cause 38% of cases. High blood sugar acts like sandpaper on the kidney's delicate filtration system. Over time, it damages blood vessels and nerves in the kidneys. If you're diabetic, you're automatically at high risk. 2. High blood pressure, 28% of cases. Hypertension forces your heart to pump harder, damaging blood vessels throughout your body, including in your kidneys. It's a vicious cycle. Kidney damage can worsen blood pressure. 3. Heart disease and stroke. Poor circulation affects kidney function. Your kidneys need adequate blood flow to work properly. 4. Family history and genetics. Some kidney diseases run in families. If your parents or siblings have kidney disease, your risk increases significantly. Secondary risk factors. 1. Age. Risk increases after 60. 2. Race. African Americans, Hispanics, Native Americans, and Pacific Islanders have higher rates of the disease. 3. Obesity. Excess weight strains all organs, including the kidneys. 4. Smoking. Reduces blood flow to the kidneys and increases blood pressure. 5. Excessive alcohol consumption can cause dehydration and electrolyte imbalances. 6. Medications that can harm kidneys. NSAIDs, ibuprofen, naproxen, when used long-term. Certain antibiotics. Contrast dyes used in medical imaging. Some blood pressure medications when not monitored properly. Herbal supplements, especially those from unregulated sources. 7. Environmental and lifestyle factors. Chronic dehydration, high sodium diet, excessive protein intake, exposure to toxins, heavy metals, pesticides, recurrent kidney infections. Kidney stones, enlarged prostate, in men, autoimmune diseases like lupus. Key message highlight. The critical point here is that many of these risk factors are interconnected and preventable. Controlling diabetes and blood pressure alone could prevent the majority of kidney disease cases. Prevention strategies. The good news. Most kidney problems are preventable. Here's your comprehensive prevention playbook. Blood sugar control, for everyone, not just diabetics. Target A1C below 7% if diabetic. Maintain fasting glucose under 100 mg per deciliter. Regular monitoring every 3-6 months. Work with your healthcare team for personalized targets. Blood pressure management. Target below 140/90ths of a millimeter of mercury, 130/80ths if you have diabetes or kidney disease. Monitor at home regularly. Reduce sodium to less than 2,300 mg daily. Maintain healthy weight. Exercise regularly. Limit alcohol consumption. Manage stress effectively. Hydration strategy. Aim for 8-10 glasses of water daily. Adjust for activity and climate. Monitor urine color. Pale yellow is ideal. Increase intake during illness, exercise, or hot weather. Limit sugary drinks and excessive caffeine. Weight management. Maintain BMI between 18.5–24.9. Even 5–10% weight loss can significantly reduce risk. Focus on sustainable lifestyle changes, not crash diets. Exercise protocol. Minimum 150 minutes moderate aerobic activity weekly, which means 30 minutes of exercise for 5 days a week. Include strength training 2 days per week. Start slowly if you're sedentary. Consult your doctor before beginning any exercise program. Smoking cessation. Smoking reduces kidney blood flow by up to 20%. Quitting improves circulation within weeks. Seek professional help if needed. Nicotine replacement, counseling, medications. Medication safety. Never exceed recommended doses of over-the-counter pain relievers. Always inform doctors about all medications and supplements. Stay hydrated when taking medications. Regular kidney function monitoring if on long-term medications. Regular health screenings. Annual kidney function tests, creatinine, GFR, protein in urine, blood pressure checks. Diabetes screening. Cholesterol monitoring. Infection prevention. Practice good hygiene. Treat urinary tract infections promptly. Stay up to date with vaccinations. Avoid exposure to toxins when possible. Stress management. Chronic stress raises blood pressure and blood sugar. Practice relaxation techniques, meditation, deep breathing, yoga. Maintain social connections. Seek professional help for chronic stress or mental health issues. Special considerations for high-risk individuals. If you have diabetes, high blood pressure, or family history, you need more aggressive prevention. More frequent monitoring, every 3-4 months, stricter blood pressure and glucose targets. Consider ACE inhibitors or ARBs, with doctor approval, annual microalbumin testing. Treatment options with pros and cons. When prevention isn't enough, multiple treatment options exist. Let's examine each with their benefits and challenges. Stage 1-3 Chronic kidney disease management. 1. Lifestyle modifications. Pros: no side effects when done properly. Improves overall health. Can slow or stop disease progression. Cost-effective. Improves quality of life. Cons: requires significant lifestyle changes. Results take time to show. Requires consistent motivation. May not be sufficient alone in advanced cases. 2. Medications. ACE inhibitors, ARBs, blood pressure control. Pros: protect kidney function beyond blood pressure control. Reduce protein in urine. Cardiovascular benefits. Well-studied and effective. Cons: potential side effects, cough, elevated potassium, low blood pressure. Requires regular monitoring. Not suitable for everyone. Pregnancy, certain heart conditions. Diabetes medications. Pros: modern options, SGLT2 inhibitors, GLP-1 agonists, provide kidney protection. Can aid weight loss. Cardiovascular benefits. Cons: cost can be significant. Side effects vary by medication. May require multiple medications. Regular monitoring needed. Phosphate binders and other mineral management. Pros: prevent bone disease. Reduce cardiovascular complications. Help manage mineral imbalances. Cons: multiple daily doses required. Gastrointestinal side effects. Can interfere with other medications. Expensive. Stage 4-5. Advanced treatment options. Hemodialysis. Pros: immediately life-saving. Performed at specialized centers with trained staff. Social interaction with other patients. Established, reliable technology. Insurance typically covers costs. Cons: requires 3-4 sessions per week, 3-4 hours each. Significant lifestyle restrictions. Potential complications. Infection, blood clots, low blood pressure. Dietary and fluid restrictions. Fatigue after treatments. Vascular access issues. Travel limitations. Peritoneal dialysis. Pros: can be done at home. More flexible scheduling. Better preservation of residual kidney function. No need for vascular access. Can travel more easily. Less dietary restrictions than hemodialysis. Cons: risk of peritoneal infection, peritonitis, requires dedicated space at home. Daily commitment, 4-6 exchanges or overnight, not suitable for everyone. Abdominal surgeries, hernias, family support often needed. Storage space for supplies required. Kidney transplantation. Living donor transplant. Pros: best long-term outcome. Can be scheduled when optimal. Better kidney function. Shorter wait time. Donor and recipient can plan together. Cons: requires willing, compatible donor. 2 surgeries, donor and recipient, risk to healthy donor. Emotional complexity for families. Limited donor pool. Deceased donor transplant. Pros: no risk to living person. Available to more patients. Excellent long-term outcomes. Cons: unpredictable timing. Longer wait times, 3-5 years average. Organ may not be optimal quality. May receive call at inconvenient time. Both transplant types share. Pros: best quality of life. Freedom from dialysis. Normal diet and fluid intake. Ability to travel and work normally. Better long-term survival than dialysis. Cons: major surgery with inherent risks. Lifelong immunosuppressive medications. Increased infection and cancer risk. Regular medical monitoring required. Potential for rejection. Expensive, though usually covered by insurance. Not everyone is a candidate. 6. Conservative management, non-dialysis. Pros: avoids dialysis-related complications. Focuses on comfort and quality of life. Less burdensome medical care. Can be appropriate for elderly with multiple conditions. Cons: shorter lifespan than dialysis. Transplant requires excellent supportive care, limited to certain patient populations. Symptoms may worsen over time. Choosing the right treatment. The best choice is to have a discussion with your doctor to choose the most appropriate treatment for you. Your family should be part of this discussion. However, following factors may be considered while taking the decision: stage of kidney disease, patient age and overall health, lifestyle preferences, family support, geographic location, personal values and goals. Dietary guidelines for all stages. Diet plays a crucial role in the well-being and function of your kidney. Let's break this down by stage. Prevention diet, healthy kidneys. The DASH diet approach: 4-5 servings fruits daily, 4-5 servings vegetables daily, 2-3 servings low-fat dairy, 6-8 servings whole grains, 4-5 servings nuts, seeds, legumes weekly. Limit red meat to 6 ounces or less daily. Key principles: sodium, less than 2,300 mg daily, 1,500 mg if high blood pressure. Stay hydrated, 8-10 glasses water daily. Limit processed foods. Choose lean proteins. Moderate alcohol. Women 1 drink per day, men 2 drinks per day maximum. Early CKD. Protein management: 0.8-1.0 grams per kilogram body weight. Choose high-quality proteins: fish, poultry, eggs, dairy. Plant proteins: beans, quinoa, tofu. Limit red meat and processed meats. Sodium reduction. Target: less than 2,000 mg daily. Read labels carefully. Cook at home more often. Use herbs and spices instead of salt. Avoid processed and restaurant foods. Phosphorus awareness, stage 3+. Limit: dairy products, nuts, seeds, chocolate, cola. Choose lower phosphorus grains, rice, pasta versus whole grains. Work with dietitian for meal planning. Advanced CKD, stages 4-5, pre-dialysis. Protein restriction: 0.6-0.8 grams per kilogram body weight. Focus on complete proteins. Work with renal dietitian for meal planning. Consider protein supplements, only if prescribed by a doctor. Potassium management: limit high potassium foods, bananas, oranges, potatoes, tomatoes. Choose lower potassium alternatives: apples, berries, white bread. Leach potassium from vegetables by soaking and double boiling. Phosphorus control: avoid foods with phosphate additives. Limit dairy, nuts, chocolate, cola. Take phosphate binders with meals if prescribed. Fluid restriction, if applicable, may need to limit to 32-48 ounces daily. Count all fluids: soup, ice cream, gelatin. Monitor daily weight. Follow dietitian's advice. Dialysis diet. Hemodialysis. Higher protein needs: 1.2-1.4 grams per kilogram. Strict fluid limits between treatments. Phosphorus and potassium restrictions continue. May need extra calories due to treatment. Stress. Peritoneal dialysis. Even higher protein needs: 1.2-1.5 grams per kilogram. More liberal fluid allowance. Less restrictive potassium limits. Watch for glucose absorption from dialysis fluid. Post-transplant diet. Immediate post-surgery, 0-3 months. Higher protein for healing: 1.3-2.0 grams per kilogram. Adequate calories for recovery. Good food safety practices. Immunosuppression: limit potassium and phosphorus initially. Follow the doctor's advice. Long-term post-transplant. Heart-healthy diet to prevent cardiovascular disease. Weight management. Immunosuppressants can cause weight gain. Bone health focus: adequate calcium and vitamin D. Cancer prevention: plenty of fruits and vegetables. Food safety remains important. Universal dietary tips. Meal planning strategies: plan weekly menus. Prep ingredients in advance. Keep emergency kidney-friendly snacks. Learn to read nutrition labels. Cooking techniques: grill, bake, steam instead of frying. Use fresh or frozen vegetables over canned. Make homemade sauces and dressings. Experiment with herbs and spices. Eating out guidelines. Research menus online beforehand. Ask for modifications. No salt, sauce on side. Choose grilled over fried. Control portions. Bring your own salad dressing, if needed. Remember, dietary needs are highly individual. Always work with a registered dietitian who specializes in renal care, as they can create a personalized diet plan tailored to your specific lab values, treatment stage, and personal preferences. The meal plans provided above are simply guidelines. Post-treatment precautions. Whether you've had dialysis, transplant, or other kidney treatments, ongoing care is crucial for long-term success. Universal post-treatment care. 1. Regular medical monitoring. Keep all scheduled appointments. Lab work frequency varies by treatment, stability and doctor's advice. Blood pressure monitoring at home. Weight tracking, daily for some patients. Medication compliance is non-negotiable. 2. Infection prevention. Hand hygiene is critical. Stay up to date with vaccinations, discuss live vaccines with doctor, avoid crowds during illness outbreaks. Proper wound care. Dental hygiene. Infections can affect kidneys. 3. Medication management. Never stop medications without doctor's approval. Keep updated medication lists. Inform all healthcare providers about the kidney condition. Avoid nephrotoxic medications. Use pill organizers and reminders. Post-dialysis specific precautions. Access care. Hemodialysis. Keep access arm clean and dry. No blood pressure cuffs or needles in access arm. Watch for signs of infection, redness, warmth, drainage. Feel for thrill and listen for bruit daily. Sleep on opposite side to protect access post-treatment care. Apply pressure to needle sites until bleeding stops. Monitor for unusual bleeding or bruising. Stay hydrated but within fluid restrictions. Report any concerning symptoms immediately. Peritoneal dialysis. Sterile technique for all exchanges. Monitor exit site daily for infection signs. Report cloudy dialysis fluid immediately. Maintain supplies and clean storage area. Have backup plan for equipment failure. Post-transplant precautions. Immunosuppression management. Take medications exactly as prescribed. Never skip doses. Monitor for drug interactions. Regular lab monitoring for drug levels. Understand signs of rejection and infection. Lifestyle modifications. Sun protection. Increased skin cancer risk. Avoid large crowds when possible. Food safety precautions. Regular cancer screenings. Dental care before procedures. Avoid live vaccines. Long-term health monitoring. Annual comprehensive exams. Cardiovascular health screening. Bone density monitoring. Eye exams. Skin cancer screenings. Emergency situations. Seek immediate care for patients. Severe nausea, vomiting. Preventing medication intake. Signs of infection. Fever, chills, unusual fatigue. Chest pain or difficulty breathing. Severe swelling. Changes in urination. If you still produce urine, mental confusion or changes. Dialysis patients. Access problems. No thrill, bruit, excessive bleeding, signs of infection. Severe cramping during or after treatment. Chest pain during treatment. Difficulty breathing. Transplant patients. Fever over 100.4 degrees Fahrenheit. Decreased urine output. Pain or tenderness over transplant. Severe nausea, vomiting. Signs of rejection. Fatigue, swelling, decreased urine. Building your support system. Join kidney disease support groups. Connect with other patients. Educate family members about your condition. Maintain open communication with healthcare team. Consider counseling for emotional support. Quality of life focus. Remember, kidney disease is manageable. With proper care, many patients live full, productive lives. Regular exercise is usually possible and beneficial. Travel is often feasible with planning. Work and social activities can continue. Family relationships can remain strong. Final thoughts. Your journey with kidney health is unique. Stay informed, stay compliant with treatment, follow the doctor's advice closely, keep your spirits high, and maintain hope. Medical advances continue to improve outcomes for kidney patients. Conclusion: we've covered a lot of ground today, from understanding how your kidneys work to preventing the problems, exploring treatment options, managing your diet, and staying healthy post-treatment. Key takeaways. Early detection saves lives. Get regular checkups. Most kidney disease is preventable through lifestyle choices. Multiple treatment options exist for every stage. Diet plays a crucial role throughout your journey. Post-treatment care is essential for long-term success. If you found this information helpful, please like this video and subscribe for more health contents. Share this with anyone who might benefit from kidney health knowledge. Important disclaimer. This information is provided for informational purposes only and should not replace professional medical advice, diagnosis, or treatment. Always consult with qualified healthcare providers for personalized medical guidance. Individual cases may vary significantly, and treatment recommendations should always be based on comprehensive medical evaluation by licensed, qualified medical specialists. If you suspect you may have symptoms of a kidney problem or have risk factors, seek immediate medical attention from qualified healthcare professionals. Always consult with your healthcare provider before starting or making any changes to your treatment or diet. Take care of your kidneys, and they'll take care of you. Until next time, stay healthy. The end.